Welcome back. Breast cancer is the most common cancer found in women around the world. And while a recent study found that mammogram rates are rebounding to pre-pandemic levels, doctors in our area want to remind women why it is so important to get screened during this Breast Cancer Awareness Month. In tonight's Parenting and Pregnancy, sponsored by Women's Care, KEZI 9 News anchor Renee McCullough shows us how just a few minutes out of your day could save your life.
42,000 women die every year from breast cancer in the United States, which is why it's important to find it early when it's easier to treat. That's why doctors recommend your first mammogram when you're 40.
So they're important because it's often the first time we spot a lump or abnormality in a breast. It's much more sensitive and accurate than just doing a clinical breast exam or a self-breast exam. So we can find a lump much smaller and therefore start treatment earlier if needed.
Dr. Heather York with Women's Care says while the test can be a little awkward, it is fairly quick.
It's maybe 10 or 15 minutes in the exam room. We get 2 views of each breast, so it is a bit of an awkward exam just based on what it is. You have to position your neck and your arms in a funny position, but we compress the breast between the plates in 2 directions.
Women's Care uses a 3D machine so radiologists can get a more accurate look at any abnormal lumps or calcifications. And they compare the latest images to previous exams to look for changes.
So if you have an abnormal mammogram, then the next step would usually be to do a diagnostic mammogram, which is another mammogram just looking at that specific area of abnormality in the breast.
While annual screenings are important, Dr. York says women also need to continue to do self-breast exams once a month so you know what normal breast tissue feels like and you can watch for any new lumps or changes.
The best time to do it is right after having a menstrual period because then the hormone levels are lowest and the breast tissue is less dense and less tender.
And for those first-timers nervous about that first mammogram, Dr. York says not to put it off.
I always tell them it's not a big deal. We all survive it.
Those 15 minutes in the exam room could save your life.
And that was Renee McCullough reporting. And while some women don't have any symptoms, if you have pain in your breast, a new lump, or changes in the size or shape of your breast, you should contact your doctor.